Provide privacy, do hand hygiene. Hi, I'm Denisha. I'm going to be your student nurse today. We're going to be doing a full head to toe assessment on you. Could you give me your name and date of birth, please?
12/29/1997.
All right. And any allergies?
Nope.
Okay. And Morgan, are you currently in any pain right now?
No pain.
Okay. Are you currently on any medications?
Nope.
Okay. Do you smoke? Alcohol? Drug use?
Nope.
Okay. Any past medical history?
No.
Any surgical history?
Nope.
Okay. So as I'm looking at my patient now, I can see that her position is erect. She's sitting up straight. Her general behavior seems to be calm for the situation. Her appearance seems to be kept up. Her hygiene is adequate. Her speech is normal. There's not any slur speech or anything. Okay, so I'm just gonna touch your skin really fast just to inspect it. Okay. Do this for any edema. Okay. So skin seems to be warm pink and intact. Her skin color is normal for her ethnicity. There weren't any abnormalities. And then I'm just going to check your skin turgor. Okay. Hydration seems to be adequate with the skin turgor. And then your cap refill. Yep, that's less than 3 seconds. Okay, radial pulses seems to be equal. They're strong, 2+. Okay, I'm just going to take your radial pulse while we're here. Okay. Patient's pulse seems to be about 72. Okay. So now first I'm going to check your hearing. Do you hear that in that ear? What about this ear?
Yep. And
then what about both ears? Okay. Her ears and her nose, her eyes, everything seems to be symmetrical. Right. All right, pupil size seems to be about 3 millimeters. All right. And then, and I'm just gonna flash this light in your eyes. All right. And then, can you look directly at my chest, and then follow the pen with your eyes without moving your head. All right. So the pearlescent pupils are equals round, reactive to light, and they do accommodate. There were no nystagmus present during the 6 cardinal signs of gaze. And then I just have this chart for you to look at, so can you read the smallest line that you can see for me?
A, K, C, E, D, F.
Okay. Her external eye structures, there's no abnormalities present. Her eyelashes do go the correct way. The lacrimal ducts aren't draining anything. So no abnormalities with that. And then can you open your mouth for me? And then stick your tongue out. Okay. The mouth is pink, moist, and intact. I don't see any neck or abnormalities, just on inspection. Okay. So no jugular vein distension present. There is no swelling in her lymph nodes or anything, and her tracheal is midline, so no deviations. Okay. And then your upper extremities, can you stick your arm out for me? Okay, her arms do seem to be symmetrical. I'm going to push her arms down and then push up against me. All right, and then push up against my hands. Okay, squeeze my hands for me. Okay, strength seems to be adequate in both extremities. Okay, so can you stand up for me? All right, so right now I'm just inspecting her shape. Her APT is 1 to 2. Okay. There's no barrel chest, no tripod position, she's standing erect. Okay, so now I'm just going to listen to your heart sounds, or your lung sounds first. All right, and then take a few deep breaths for me, Morgan. Okay. So just from the back, there is no cough present, there's no wheezing, no crepitus present. Okay. So lung sounds do seem to be clear. Okay, so now we're going to take a quick listen to your heart sounds. So then we're going to do APETM. Okay. So her heart rate seems to be regular. S1 and S2 sounds heard. Okay, so now I'm just going to do your apical pulse. So I got about 72 for her apical pulse. So I'm going to have you take a seat. Okay. So right now I'm just going to inspect my patient's abdomen. As I can see just on inspection, her abdomen seems to be round. Bowel sounds are present in all 4 quadrants. Okay, so upon palpation, the abdomen seems to be non-tender. I didn't feel any hernias and the abdomen was not distended. So now I'm going to take a look at your legs. Alright, and then can you push your feet to me? And then against my hands. Alright, so right now I'm just going to check the dorsal pulse. Alright, and then dorsalis pieces. Alright, so pulse seems to be +2, they're strong. Cap refill is less than 3 seconds. Skin is warm, pink, and intact. There seems to be no edema present. Okay. Just gonna reposition my patient, make sure that she's comfortable, give the patient their call light. I'm gonna document all of my findings. I'm gonna do hand hygiene and thank my patient for their time.